Cindy Nagel live from Horizon Dental today on, I think it's July the 20th. It's a Thursday, so it is our last day in the office this week, but something came to my attention today that the Globe and Mail released an article in their health and fitness section with some questions about dental x-rays. A lot of the times when these articles come up, it makes people ask a lot of questions about the safety for the x-rays and why we take them. I actually liked the article for a lot of reasons because first off, one of the first statements that it makes is that the amount of x-rays that we take should be individualized. And I agree with that 100%. Not every person needs the same number of x-rays or the same type of x-ray. The other thing that I thought was kind of neat about this article is that it does pretty accurately summarize the different types of x-rays we use, like the bite wings, which we use to screen primarily for cavities between the teeth, periapical x-rays, which will usually capture 1 to 4 teeth in a segment and lets us see all the way to the root, and then the panoramic x-ray, which lets us see, all the way up to the jaw joints, the sinuses, and we can see the entire mandible. So what I do with x-rays at Horizon Dental is almost every new adult patient will get one of those panoramic x-rays. The reason I do this is because I want to see the big picture. I want to see what your jaw joints look like. I want to see what your jaw looks like. I need to see if there's any hidden wisdom teeth in there or anything abnormal about the bone itself. And I can't get that information without one of these panoramic x-rays. From there, I also get a good idea of what the teeth look like. So again, most new patients are going to need those bite wings, those x-rays that are going to screen for cavities between the teeth where I can't see them in your mouth. But it also gives me a chance to see if there's anything globally with the teeth on that panoramic x-ray where I might want one of those periapicals, where I might want one of those snapshots of the entire tooth. So sometimes I can see an infection, or if you have a crown or gum disease, these are reasons for taking these periapicals. So I think that, we do a pretty good job of individualizing these x-rays at Horizon Dental. We definitely don't give everybody, like the person in this article, it says that she had 22 x-rays taken. Definitely not every person needs 22 x-rays. So I hope that the dentist had a good reason for taking that many on this particular individual. One of the other things that I thought I would bring up today, I just need to find it. All I did was Google dental x-ray dose comparison, because a lot of the times, you might not realize that radiation, or, the energy that we use to create the x-rays, it's not all equal. So the x-rays that we take for your teeth are much different compared to the kind of x-rays that you'll get for your heart, or if you have like a CAT scan or any of these medical grade x-rays. They're very different from ours. And you also have to understand that our environment has radiation. We have solar radiation, so the sun, every time you fly on a plane, you get double dosed with radiation because you're getting closer to the sun. There's even radiation that can come out of the ground in some areas depending on where you live. So I was just looking at this, and I can flip it around to see if I can show you the chart. You can see the chart here, the radiation exposure comparison chart. So your daily environmental exposure. So this is just what you get from walking outside. It's 0.01 millisievert, and that's how we measure the amount of radiation. And then you look at a single periapical, 0.001. 4 bite wings, which is the average for an adult, is 0.004. And even that, 18 to 20, the full mouth series, that is even still not quite as much as you get from just walking outside. It's still less than that 0.01. One other thing that's interesting here is you have to compare this D speed here, this F speed. That's referring to film x-rays where they have to be developed. You need more power in order to turn this back around. You need more power in order to develop those kinds of x-rays. So here at Horizon Dental, we have digital x-rays, we have digital sensors, our panoramic x-ray machine is all digital, and that reduces the amount of radiation. So I'm reading here, you look at the D-Speed, that full mouth series, those 22 x-rays, which would be the maximum that you need, at 0.0085. With the digital, the same number of x-rays, 0.0039. So that's cut in half, less than half of the kind of exposure that you would get. So these are actually really great things about dentistry, is that as the technology improves, we are finding ways to cut out some of these risks and some of these concerns. Yeah, I don't know that these are the most common questions that I have, and this is one of the best ways that I know of to really try and help people understand, why the x-rays might be necessary and what the real risk really is. That, you go walking outside or fly in a plane and you're going to get way more radiation than any of my machines can create. But I hope that if anybody does have any other questions or concerns, that you'll message me or give us a call at Horizon Dental and let us know. Have a great day, everybody.